We'll begin with fresh warnings on Covid-19. Global cases have now reached 16 million and the infection rate is escalating. We'll take a detailed look at the state of the pandemic. That'll include the latest on the UK's decision to impose a 14-day quarantine on arrivals from Spain. And we'll look at Vietnam. It sees its first coronavirus cases for 3 months and reacts by flying 80,000 tourists out of one city. Plus, we'll look at Lebanon, where there are warnings it's on the brink of losing control of the virus. These pictures are of an underground car park in the north of the country being used to train medics. There are calls for a new lockdown there. Well, it's been almost 6 months since Covid-19 was declared a public health emergency, and this is what's happening now.
The pandemic continues to accelerate. In the past 6 weeks, the total number of cases has roughly doubled.
Well, across today's Outside Source, we'll have a detailed look at the pandemic, how it's escalating and how it's being tackled. Let's start with the headline statistics, and they're stark. There are over 640,000 confirmed fatalities and more than 16 million confirmed cases. And look at the infection rate the WHO was talking about. It took 38 days to go from 5 to 10 million confirmed cases, to go from 10 to 15 million. That took 24 days. The last million confirmed cases took 4 days. The infection rate is increasing. And you can see the global story of the pandemic in these graphs. The virus was first identified in China. There were then major outbreaks in Europe and North America in April. As they began to ease in May, Latin America and Asia saw significant outbreaks of their own. And while Europe's case numbers have largely continued to fall, North America has seen a resurgence of infections, mostly in the US. And Latin America is now the epicenter of this pandemic, with Brazil by far the worst affected there. And despite the complexity of this pandemic, the WHO says essentially this is a simple challenge.
Find, isolate, test and care for cases and trace and quarantine their contacts. Keep your distance from others, clean your hands, avoid crowded and enclosed areas, and wear a mask where recommended. Where these measures are followed, cases go down. Where they are not, cases go up.
Now, we've often featured analysis on Outside Source that says the only real end to all of this will come when there's a vaccine. But now we have a caveat against even that. The virologist Klaus Stoer played a key role for the WHO during the SARS pandemic in the 2000s. He said the majority of the world population will not receive a vaccine. The virus will continue to spread. It could take 2 to 3 years before the virus has affected a large majority of the population. And he goes on, it's not the vaccine that's going to end the pandemic. The virus will end this pandemic by burning every piece of dry wood it will find. The fire will not go out before the last susceptible person has been affected. And he's been speaking to the BBC today.
80% of the global vaccine production is located in European countries. There's also, of course, in the US. India has a significant vaccine production, but it will not suffice to immunize that many people, to produce a vaccine first and later on immunize that many people before the virus will have spread globally to almost every person by most likely end of next year or in 2 years' time.